Good morning, everybody. Can I welcome you to this rearranged meeting of the People and Health Scrutiny Committee? My name is Councillor Tony Coombs and I'm the current chair. My vice chairman is Councillor Jane Somper. I'm very pleased to welcome two new members to our committee, Barry Gorringe and Andy Todd, who are replacements for previous people in this new municipal year. I hope you'll enjoy your time with us. We do like to cover a lot of bits and pieces. So you're very welcome, and it's nice to have you on board. George, do we have any apologies, please?
Yes, we have apologies from Councillor Carol Wood, and just for information, Sally Holland is joining online.
That's lovely, thank you. Do we have any declarations of interest from members of the committee? Carol, your hand went up, and then Andy.
Thank you, Chair. I'm just declaring an interest in the item on the cost of living support. It's not a personal pecuniary interest. I just am a trustee of a charity that has benefited from funds.
Councillor Andy Todd, I declare an interest in item 8 on EHCP reports. I have a member of my family who is a recipient of EHCP within Dorset.
That's lovely. Thank you both very much. Okay, you have the minutes of the meeting held on the 6th of May. Are you happy that I sign them at the end of the meeting as a correct record of that meeting? Yeah. Thank you very much. Okay, item 4 is public participation, and we have received no formal questions for this meeting. Likewise for formal questions from members of the council. You'll be pleased to know that there are no urgent items, so we can move straight on to our first item, which is maternity services in Dorset. I have asked that we do the presentations in a particular order, because I think it's very important that we understand the full picture across Dorset before we look into the issues surrounding Yeovil Hospital at the moment. So we have with us from the NHS Hannah Leonard, who is Deputy Director of Maternity and Perinatal Services for NHS Dorset. And we have Anita Thomas, who is the Chief Operating Officer from Dorset County Hospital. And I believe, Anita Thomas, you're going to take us into the initial presentation?
Good morning. Thank you ever so much. Yes, I'm Anita Thomas, Chief Operating Officer at Dorset County Hospital. Hannah is here with us this morning. And then if I may just introduce the rest of my colleagues.
Good morning, everyone. I'm Jo Howarth, and I'm the Director of Nursing here at Dorset County Hospital.
I'm Dr. Audrey Ryan. I'm a consultant obstetrician and gynaecologist, and I'm the Divisional Director for Family and Surgical Services.
And I'm Jo Hartley. Good morning. I'm a midwife. I'm the Director of Midwifery and Neonatal Services here at Dorset County Hospital and the Clinical Director.
Thank you very much. In light of the comments we were sent just before we started, we will do it in the following order. Hannah will take us through the broader issues in play here. Then Audrey will talk to us about maternity services. Jo Hartley, Jo Hartley about the CQC, and then Jo Howarth around the YDH interventions. So if everybody's happy, we'll continue in that order, starting with Hannah. Hannah has shared a paper in advance, which we'll assume has been received and read, unless otherwise instructed, and then just take you through the key points.
Thank you very much. Good morning, everybody. Can I just check, because I'm on the far side of the table, that everybody can hear me and that it's okay? Loud and clear. Fantastic. So you'll see that we've provided a short overview of the services at UHD. This is the maternity service that was originally provided at Poole and has transferred to the Bournemouth Hospital site in March this year. And also an update from Salisbury Maternity Services following their CQC inspection and the changes that have happened there. I'd be very happy to take the paper as read, and then if there is any questions from the committee, I'd be happy to answer those further.
Okay.
I'm through the paper if you'd like, if that would be easier.
No, that's absolutely fine. I'm sure members have read the paper. There were, if I sort of kick off, one of the things that you mentioned in the paper was that BCP Scrutiny last year did look at the issues at Poole. I did go and have a look at that report, and I have to say I was quite disappointed that it was a paper for information and there's no record of any questions being submitted to the chairman after the meeting. The paper was good in the fact that it was highlighting all the good points about moving across to the beach, and I certainly had and I call it a pleasure of visiting the whole of the unit before it opened, and the facilities that are being provided really are going to be second to none. And what really struck me was, particularly for families where there is perhaps not a positive outcome from their pregnancy, the way that that was being handled was so sensitive, and I was really, really impressed with the thought that had gone into that, and the security, the facilities for families to be with the expectant mum during their time there. I've got nothing but praise, so I think it was very well planned, and I look forward to seeing the full transfer of paediatrics. I think it's at the end of this year. So really it's just a big compliment on that, and I suppose a little bit of a disappointment that BCP didn't actually look at some of the issues about the CQC report in Poole. So perhaps you can give us an idea of where we are now on the journey for both Poole and Salisbury, because obviously things have moved on and they move on a weekly basis.
Yes, thank you. I think it's fair to say in Dorset we've had a significant period of change over the past 2 to 3 years, not only with the new bill, but we obviously have had some disappointing CQC inspections, but as a result of that there's been quite a lot of improvement work. So in terms of UHD, they sadly were rated as inadequate. And as a result of that, they ended up on the National Maternity Safety Support Programme, which is led by NHS England. That's a very structured programme. It's in 3 phases. It starts with a diagnostic phase. So they have an independent person who comes in, who does a diagnostic review looking at what the causes were or the contributions that led to where the CQC found their failings. After that diagnostic report, they then enter an agreed improvement phase with a significant list of actions. And as part of the ICB, we've been joint with NHSE in terms of that process and received regular assurance and had tripartite meetings with the Trust on their progress. The improvement phase itself lasted 18 months, and actually UHD have done significantly well in that. A lot of units have ended up with a longer improvement or sustainability phase, and that is against a backdrop of all of the transformation work about moving to the new hospital build as well. We have seen that they have made significant investment in terms of their staffing, their leadership. They have reformed their governance structures. Their engagement with our maternity and neonatal voices partnership, so there are service users, has significantly increased. And I think that's testimony actually to how safely and effectively the move happened at the beach building with the input from our service users. In March this year, in October last year, at the end of the 18-month period, we have a reset and review period of time. And so at that point, they moved from the improvement phase to a sustainability phase. And for that to happen, they have to have very set criteria for exit. And so as a group of stakeholders, and again, that involves service users, we met with UHD, with NHS England, and we agreed that at that stage we were happy for them to move into the sustainability phase of the programme. We were very mindful about the impact of the hospital build. However, they had demonstrated fantastic progress in terms of outcomes from surveys, from national surveys, from staff surveys, and that gave us quite a strong amount of assurance that they would be successful in the next 6 months of their journey towards exit. We were mindful that the exit criteria meeting was in very quick succession around the move. However, the programme is quite set in terms of its outcome measures. And so in March, we held the exit review meeting, and actually UHC had managed to sustain that high level of achievement despite the imminent move and all of the gateways that were happening for the move at the time. So at the end of March, it was agreed that they would go forward for exit. That exit process is quite protracted. So once it's agreed at a local level, it must be agreed at the Trust Board, it must be agreed at the ICB Board, it must go to the Regional Quality Oversight Group for the South West region. And so all of those 3 phases have happened and approval has been supported. The last phase that's happening in July for the final formal exit from that programme is with the National Board. And we don't expect there to be any issues with them moving off of the programme at that point. The oversight and the assurance doesn't actually end there, because the sustainability plan, for it to be successful and for them to be supported in exit, requires an ongoing level of assurance around maintaining certain things that were put in place during the national programme and oversight of that, of which there has to be a commitment from both the ICB, so the Integrated Care Board, and the regional quality team. And we continue to monitor that through our local maternity and neonatal system board locally, and that is then through an escalation paper overseen by the quality subcommittee in the ICB.
Thank you, that's really helpful. Do you want to give us an overview for DCH, Dorset County Hospital, as well, or where they are on their journey?
I'm very happy to, but actually I think if it's okay with yourself, I'd like to hand over to Jo, who's our Director of Midwifery at Dorset County Hospital.
Absolutely, that's fine.
Thank you.
Thank you. So, as you will be aware, we had our inspection in June 2023, where we were issued with a Section 31, for which we took immediate action to rectify the issues that CQC had raised. The next month, we received a Section 29A with a significant amount of actions required in relation particularly to governance and audit. So our overall CQC report was requires improvement. And we took the decision early that what we would like to do is to employ our own maternity improvement advisor, because we were concerned that there could be a delay with support from the MSSP programme. So with our Director of Nursing support, we employed our own maternity improvement advisor, who is a midwife who has worked with the MSSP himself for a number of years. He's worked really closely with us and has supported us on our journey to improvement. The oversight of that journey, as Hannah has described for UHD, has been very similar in the way that we have worked with the LMNS, which is the local maternity and neonatal system, and with the ICB, and with NHS England. We proceeded on our improvement journey. We were very well supported by the Trust in both financial aspects and with cultural improvement, and with support from senior managers to assist us as we moved forward. We had an insight visit, which is provided yearly by the LMNS and NHS England, which was very positive in November 23. In 2024, the business case to increase staffing for the maternity service was supported by the board, and that saw an increase in the number of midwives working. Meanwhile, we were working towards increasing the number of consultants that we had working in our service, and in May in 2024, a 9th consultant joined us. We continued with the work that was required. We've restructured our governance processes. We have strengthened our leadership team with an additional layer within our leadership team. We have significantly strengthened our audit process, and we have demonstrated a much clearer understanding around outlier status with any governance issues and how those are escalated to the board, and board escalated to the LMNS and the ICB as required. In September last year, we had a meeting to review our progress with our CQC action plan, which was very positive, and we had the LMNS and we had NHS England with us at that point. We continued on our path of improvement and recently have met all the requirements within our CQC report, and that is the must-dos and the should-dos. We continue to look for ways to improve, and we proactively look for anything that suggests that we may not be maintaining the standards that are required. We have moved forward. We have submitted our Birth Rate Plus report, which is the national audit system for safe staffing for the maternity service, to the executive team. We have, in early 2025, we've declared full compliance to the Maternity Incentive Scheme, which is a national scheme that requires a significant amount of compliance to 10 safety standards. We were extremely pleased to declare compliance to that because we weren't compliant the year before. We now have appointed our 10th consultant, so we are compliant with expectations around consultant presence on labour ward. And then in about a month ago, 3 weeks ago, we had a CQC inspection that was unexpected. They arrived, they spent 3 days with us, 1 day with us in person, 2 days meetings online, whilst they, as one would expect, identified some areas where some extra work and focus was required. Currently, they have not raised any significant concerns in the way that happened after our inspection in 2023. They were extremely complimentary about the culture on the unit and the feedback that they received from staff. They noted that we were compliant with the way in which we triage women using a system called BSOTS, which is an acronym around safe triaging of women when they come into a maternity unit. And this was one of the concerns that they'd raised when they visited us in 2023. They were assured by the way in which we now manage needing a second theatre and issues around who assists in that theatre. So whilst we await their report, it was a more positive experience because currently there is nothing significant for us to work on. Thank you.
Thank you. I think from both of the trusts, you have come a very long way in what is probably, in the grander scheme of things, quite a short time. Can we just quickly touch on Salisbury, because I know they've just been re-inspected and have been graded as good, but just in the interest of making sure that everyone, fully gets what's going on, can we just have a very quick update on Salisbury, please?
Yeah, of course. So Salisbury was one of the first hospitals in the maternity inspection program, for the CQC to be inspected under the new regulatory framework that they had for that period of time. Unfortunately, they received an inadequate. They received a requires improvement rating, but at the time they ended up on the maternity safety support programme under NHS England, the same as what UHD had ended up on. Their journey on that programme was slightly more protracted. There were several reasons for that in terms of the need for quite significant investment in their leadership team. They also had a change in their improvement advisor during the programme, which I think was not helpful. And they also had a change in director of midwifery. So I think that had meant that unfortunately they ended up with a slightly longer programme. However, as per the paper, they did go through the same exit process and successfully exited. Shortly after that, they were then re-inspected by CQC and were pleased to have achieved good across all the domains of the inspection.
That's really good to hear. I'm just sort of thinking, the Dorset Council area is so wide that we're not just served by one hospital. So, we've got Dorset County Hospital, who are the one that totally serves just Dorset, whereas Bournemouth, Salisbury and Yeovil do deal with cross-border So it was really important that we do understand, how the whole picture fits together in the jigsaw, because as Dorset Council, we need to make sure that all our residents do get a good service wherever they need to go for it. Before we go into the details on Yeovil, do members of the committee have, now you've heard all these extra explanations, do you have any questions on the totality of service across the piece, or are you quite happy with what you've heard? Carol.
Thank you, Carol Jones, Sturminster Newton. I just wanted to ask, for women that were due to give birth at Yeovil, will they be given a choice as to which hospital they go to? That'll come to in a minute. Okay, thanks.
Would you like me to pick that up, Chair?
Not at the moment. I'm being very clear about this. This is about the general provision across Dorset. So if you've got any questions of a general nature, then we will come on to Yeovil specifically in a moment. Chris.
Thank you. Councillor Chris Kippax, Yepminster Ward. I think what you're going to say, my question is related to Yeovil, and that's fine. But obviously there's a question of the capacity at DCH relevant to what we're going to discuss about Yeovil District Hospital. Shall we save that? Okay, thank you.
Okay. George, I can't see the screen properly. Can you keep an eye if Sally wants to come in on anything, please? So our member of the committee who is attending remotely. Okay, so I think everyone's very happy with the picture across Dorset. Would you now like to go into the detail about Yeovil, the background, how it's happened, and what the outcome is, and the plans that have been put in place to manage things going forward?
Yes, we'd be delighted to. Thank you very much. We will start with Dr. Audrey Ryan, and then Jo Howarth will pick up the extra points, and we'll try to encompass the questions that we've already heard so far. Thank you.
So just in terms of setting the scene, it is the case to reassure members of the committee that women have for decades in the UK been given choice about where they birth. This means that we've always seen cross-county travel of women who choose to birth in different places. So actually about 10% of the births at Dorset County Hospital over the previous years have been from the Somerset County. And so we have seen travel in all directions. It's also the case that women choose to come to us from Devon, women choose to come to us from the east of the county, and we accommodate the women's wishes. We provide the full range of maternity care here in Dorchester, ranging from the early pregnancy care, which can sometimes result in caring for women who sadly lose pregnancies in early pregnancy, and then that's picked up with the bereavement team, just as you mentioned, in the east of the county. We then provide antenatal care, which is both scheduled and unscheduled. Maternity care has to provide an emergency service. We're here 24/7 for the women under our care. We then obviously provide labour care, and again, that's a combination of unscheduled and scheduled care. Nationally, and Dorset is no different, there has been an enormous rise in elective caesarean section rates over the decades that I've been working in obstetrics, and we accommodate that. And then we provide the postnatal care. Throughout pregnancy, we provide specialist care for women with coexisting and pre-existing medical disorders in pregnancy, including both physical and mental health. And that involves working with our partners in the perinatal mental health team who are based within Dorset Healthcare. And that's meant that we also, on occasion, we work with our partners in the perinatal service, in the mental health service within Somerset or within Devon. We do what's necessary to promote the care of the people who are choosing to birth with us. We also provide specialist clinics for women who are at risk of or who have experienced premature birth previously, for those who have multiple pregnancies, and for women who have diabetes in pregnancy, as that's a particular high risk group. I hope that's a useful little bit of background, and I'm going to hand over to Jo Howarth now, who's our Director of Nursing.
Thank you, Audrey, and good morning, everybody. I'm going to get closer to the screen my end because I have old lady eyes and I need to be able to read off the slides as I talk to you. So councillors will have received the papers and seen that there's a very brief timeline of notification from our point of view about the Yeovil closure. And in short, we are aware that Somerset Foundation Trust had been subject to an unannounced inspection of paediatric services a short while before the closure was announced, and that they were issued with a Section 29A warning notice which set out a number of recommendations and requirements, of which included twilight cover of on-site consultant paediatric cover for their special care baby unit. This is against a background of their paediatric ward being some distance from their special care baby unit, and I understand, although the report hasn't yet been published, there were some concerns about geography and location and accessibility to emergency teams. So the Section 29A warning notice can be found on the CQC website, but we are aware that the full report has not yet been published, so we are not privy to the detail of that entire report in the same way that we've not seen our draft report yet, and that has to go through a factual accuracy process before it's published. I think suffice to say the notification period for us was quite short. About 6 days, including a Saturday and Sunday. And the timeline meant that we needed to rapidly respond to women already starting to call us as soon as the information became publicly known. And as Audrey stipulated, this is because women have choice. So this is not like a waiting list transfer or a formal transfer of care. It is down to patient choice. Thank you. So how have we responded to this? Well, the first thing is to say very quickly and very operationally in the moment, but we have weekly meetings with Somerset Foundation Trust, as well as weekly internal meetings with lots of activity taking place in order to ensure the safety of the women and their families for which we care, irrespective of postcode, because we, as Audrey has said, already see about 10% of our activity coming from Somerset, but we also see women choosing to come to us from Purbeck and actually from further east of the county. So I think it's important that councillors realise that there is equal drift across postcode areas within the Dorset system. It doesn't all sit neatly around the two services in the county. We have a number of work streams and identify clinical and expert leads, and that includes looking at clinical pathways for antenatal care, as Audrey's described, both scheduled and unscheduled, looking at the implications on paediatric cover and the paediatric element of the maternity and neonatal service, and indeed obstetrics and anaesthetics, because as Audrey has said, caesarean sections can be scheduled and unscheduled, and we need to ensure that we have a full multidisciplinary team available 24/7, 7 days of the week. But we also have a work stream around digital, because in maternity services, and fortuitously for us, Dorset and Somerset are on the same electronic maternity record. It's a system called Badgernet, and that has always allowed us to look after women who need our care, even if they come from further afield. And obviously, being close to the Weymouth and Portland catchment area, we have a lot of visitors in the summer months in particular, and that includes women who are pregnant. So actually, we're very used to dealing with women from out of area who land at our door, possibly not in the volume in the short time period that we've had from the Yeovil closure. But it does mean that we have the infrastructure, the oversight and the governance to be able to respond. So there's a digital work stream. We're working with our communications teams to make sure there's really clear comms actually not just to Somerset women and Dorset women using Somerset services, but to women that choose to use our services from wherever they may come. We're particularly focused on workforce, so we have reached an agreement with Somerset that we will be receiving midwives on secondment over to our maternity service, because these midwives equally need their skills maintaining. They need to be usefully deployed and employed, and we absolutely welcome them here at DCH. Maternity support workers, and we're working through the medical ask in terms of paediatrics, obstetrics and anaesthetics. Clearly there's a financial implication, and I would say that's probably proving to be the most challenging in terms of how this plays through, because the way that maternity services are funded is through a pathway tariff, and we absolutely want women who are local to the Yeovil area to be able to go and have their scans, for example, at Yeovil, and not have to have unnecessary travel. Even if their care is going to be with us, but we do need to make sure that the funding plays through to rectify and accommodate all of that activity. And there's an additional work stream around diagnostics, because there'll be the obvious things like ultrasound scans, but actually it includes bloods, it includes diabetic checks, as Audrey's alluded to, and other diagnostic elements of care. So we have some dedicated project support here at DCH, which means that we have a really tight programme tracker, a risk log. We're picking up issues and incidents as we go, really valuing the feedback that we are getting from our women and users of our service in terms of, as Joe's already alluded to, are we actually providing that reassurance, confidence and experience of care, and can we identify where we can do better? We've done some forecast modelling. We have some very sophisticated business intelligence dashboards now that use statistical process charts, which allow us to see where we're seeing variation, which is warranted, because babies don't just come one a day or when you want them to, they come when they want to. And so we need to be able to actually work out what's expected variation and then what's different in terms of a step change around activity, and that's activity along all of those points of care that Audrey's described. So we're doing that forecast modelling, we're doing the data mapping to really make sure that we have the resources and the infrastructure to be able to respond. In addition, it's important to say that last year our births were 1,600 a year at DCH. Yeovil saw 1,200. It's not a simple analogy to say that Yeovil's activity will go one of three ways between Musgrove, the RUH and us, because women have choice. And we're seeing about a 20% increase in demand, recognising there will have been an immediate transfer of care with the closure, but there will be a tracking down of that demand as women decide to make their choices based on the information they're given. So although we're talking about a 6-month period of closure for Yeovil, we also anticipate that if women choose to come to DCH who are not yet pregnant, but maybe become pregnant and need booking in the next 3 or 4 months, they may choose to keep their care with us. They may choose to transfer their care back depending on the decisions made within the Somerset system. So we really are being pragmatic about that forecasting and really working through what we need, anticipating that there'll be a levelling out of that activity, but there may be a longer term forecast that influences that. The maternity unit at DCH was built for 1,800 births. So we absolutely can accommodate some of that increase, but the bits that we're working through is sonography, so ultrasound scanning, capacity, staffing, equipment, and again that's why we're really keen to work with Somerset collaboratively to make sure that women and birthing people aren't having to travel unnecessarily far. And certainly, and Audrey can cover the detail, there's a particular focus on Blandford and actually increasing the offer through Blandford Community Hospital to make sure that we can equally provide that accommodation in terms of space, services and access for women in the north of the Dorset patch. The other thing I think that's really important to emphasise is the engagement with staff. And I think the meeting with our own staff, and I know there's been a staff engagement session this morning. We've been having over 50 staff of all disciplines in our staff engagement sessions here, so that we can absolutely feedback and reassure staff, but also respond to what they are flagging in terms of operational challenge and detail. Certainly an issue's come up this morning already around access to particular medication. We're linking that with our chief pharmacist and we're responding to that in the moment. So that ability to capture those immediate concerns, respond to it, but feedback to staff is really important. But the other thing I want to emphasise is we've now hosted 3 visits of staff, maternity support workers and midwives from Yeovil, and in fact we have neonatal nurses coming this week to our special care baby unit. And I think the thing I'm particularly proud of is the support we've given to those staff and the warm welcome we would give those staff, because I think that really shines a light on the spirit and the culture of the team at DCH. And I think it's really important that we are seen to be an inclusive and welcoming service, both to the staff that will come to support us, but also the women that choose to have their babies with us. So there's a summary of the kind of working day, and I think it's already been said, this changes on a regular basis, and not only has our CQC journey been rapid and evolving and reassuring, but I think the work that we're doing with Somerset follows the same vein. We have clearly identified leads from the Somerset system and from the Dorset system. We have regular touch points, regular meetings. Clearly we need to make sure we've got governance and we've got processes in place to manage risk, but there's quite a lot of detail in the slides that show you where we are in terms of progress, which will have already moved on since those slides were issued some 10 days ago. So I'll pause there. I'm very happy, I'm sure, for any of us to take questions from the floor.
Before I open it up to members of the committee, can I just ask, you've talked a lot about communication with staff, but you didn't really touch on communication with patients. Can you tell me how that has gone and the feedback you're getting from that, please?
I did touch on that in the earlier slide around the communication stream. So we have our comms teams working very closely on communication with women and their families, and a very structured comms programme and strategy. We have particularly asked that the NMVP, which is the Maternity and Neonatal Voices Partnership, are working with women from marginalised groups who maybe are in areas of digital poverty, maybe English isn't their first language. So there's a very structured comms programme, and there's been lots of communication out to women and their families, both from the Somerset system but also from Dorset. If colleagues are interested, there's a lot of detail on the Trust internet site, and we highlight and signpost to each other's comms to make sure we're being consistent in that space. So very happy to elaborate on that, but very confident that that has been a focus first and foremost.
Thank you very much. Okay, I'm going to go back first to the 2 people that indicated they wanted to speak. So Carol, then Chris, then Robin, and then Andy. Oh, okay. Carol.
I think my question was answered very well earlier. So, and presumably once a woman has made her choice, she will have immediate access to the antenatal visits in the right location.
That's absolutely right, yes. So as soon as she transfers her care, then we will set up to make sure that we can provide the best care for her in our unit.
If I could just add, we immediately identified a senior midwife to provide leadership for the team that have historically provided care for what we refer to as our out of area women, but mindful that that was going to increase significantly. The midwife who is now overseeing that is an extremely experienced community lead, and she is also our continuity lead. So she is well sighted on that space around ensuring that women are reassured, but also that communication is as it should be, and signposting for any clinics, scans, etc., as well as liaising closely with the community midwifery team in Yeovil, who continue to provide an excellent standard of care to the women, is maintained.
Does that answer your question, Carol? Chris?
Thank you. Yeah, I'm going to ask a slightly different question to start off with, if I may. Councillor Chris Kippax, Yetminster Ward. I'm just trying to unpick some of the sort of history of this. So maybe a bit of a simplistic question, but did CQC allow sufficient time for improvements to be made? Or if not, then what was the tipping point that made that so difficult? And, you know, were they acting unilaterally and without regard to what might have been planned by way of alternative services? So just trying to get to the, you know, how long in advance was it known that this would be unachievable, therefore closure had to follow? Or what was it that prompted this? Or did you tell CQC you can't make these changes in that time? Sorry, it's a bit...
If I can come in, if I may, this isn't an inspection of Dorset services, so we aren't able to answer those questions around the Somerset response and the notification, but I can explain how the CQC works. So the CQC will issue a regulatory notice if they feel that there's a breach of licence against the regulatory standards from a service. And there are usually set timeframes for an organisation to respond to those concerns. I can't answer the detail about the paediatric service at Yeovil because it's not our inspection and we don't have Somerset colleagues here that would be cited on the detail. But because we're not Somerset, we're here to talk about the Dorset response to the Somerset closures. But the CQC will be always working to the regulatory framework which is set, and we'll be working with the providers about what those expectations are. And we can only make the assumption that Somerset were not able to meet those expectations in the timeframes the CQC set.
If I can add a bit, when I was approached with the request to consider bringing an item to this committee, as you can see, I researched our local hospitals in Dorset, but I did actually look at some of the publicity and stuff around Somerset, and my understanding was that one of the major concerns was being able to operate safely from a clinical point of view because they didn't have the staff coverage. And the inference that I took was that by closing the maternity and special care baby unit for a period of 6 months, would give the hospital the capacity to be able to maintain the larger paediatric service available to the residents. And I'm sure that the people from the NHS will correct me if I've inferred all this wrong. But it seems to me that it was potentially the right decision was to make a small change, although it does impact on a lot of people, but closing an entire paediatric unit in order to make things better would have had a much greater impact across the piece. Would I be right in my summations on that?
Absolutely. It was the case that the maternity closure related to the paediatric support required for the special care baby unit. If you are running a maternity service where you're delivering women who have been under consultant-led care, it is a duty for the hospital to provide a special care baby unit, which must be staffed by paediatricians. And our understanding from the comms that we've read, as you did, in the public domain, is that Yeovil were unable to see how they would be able to stand up paediatric staffing for their special care baby unit in the time frame required. So that left them no option but to stop delivering consultant-led care for the obstetric population in Yeovil.
And we await their final report, which is not in the public domain.
Absolutely. I mean, I only picked that up from reading what was already in the public domain. I've had no conversations with anyone behind the scenes about anything. I suppose what we would need to see as reassurance is that at the end of that 6 months, hopefully that everything would have been put in place to allow that service to reopen at Yeovil. I think that's what, why we're all here. We want to see that to come back. It would be nice to ask you guys for some reassurance, but I somehow think that's not your position because obviously it's not your hospital. But maybe that is where we would like to see it go, and maybe that can be passed back. Robin, you did put your hand up. I'm really sorry. Before I carry on. Sorry, you have more, Chris?
Just thank you, Chair. Just the point about the 6 months that you made. I mean, we do need at some point some categorical reassurance, if possible, that that service will be operational again. This is too critical for too many women and families that not to have that in due course, even respecting the fact that it was not possible to achieve in the time frame. And I'm still concerned about that, but there's nothing more to be said, I don't think, on that particular. Thank you.
Thank you. Sorry, Robin, over to you.
Thank you, Madam Chairman. Let's talk some numbers. Yes, Robin Legg, I'm the member for Sherborne Rural, and I live within about 2 miles as the crow flies from Yeovil District Hospital. And I represent 20 villages in a donut around Sherborne. And I'm also a member of Sherborne Town Council. So I've got quite a lot of interest in this particular topic. If we think about the numbers, you have said that DCH had about 1,600 births in your unit last year, and that you've got effectively capacity for another 200 because it was built for 1,800. I know there's a slight disagreement in numbers. I read the Hansard report of the adjournment debate, which was led by Adam Dance, the MP for Yeovil, and he talked about 1,300 births a year in Yeovil and not 1,200. But let's stick with a 1,200 number. 1,200 is a very large number. If you can only accommodate another 200 births, and I know you've made the point about people, mothers, making a choice about where they want to go, but nevertheless, the current figures are that 1,200 people, mothers at least, give birth in Yeovil every year. So where are they going to go, and what impact is that going to have in Dorchester? It seems fairly obvious to me that you're going to be full. You're going to have at least 1,800 births a year in the next 12 months. And where are the other 1,000 births going to take place from what you might call the greater Yeovil area, which includes a good chunk of North Dorset? Are they going to go to Musgrove? Because Musgrove has got its own problems. A report in September of last year referred to the unit at Musgrove as being traumatic, super hot, and overcrowded. I can't see that suddenly 1,000 extra births are going to take place in Musgrove. You very helpfully outlined that's DCH's own journey from a Section 29A notice, which has taken 2 years. I very much doubt that this is a problem that's going to be fixed in Yeovil in 6 months. And I want to know how the numbers game is going to work. And I haven't heard anything, not a sausage this morning, from you or your colleagues about how you're going to accommodate at least 1,200 live births distributed around the other hospitals in the immediate area. And that's got to be of grave concern, both to the people I represent and those in Sherborne too, and of course of greater concern to those in Yeovil. And I'd like to have a very clear understanding of what's going to happen.
Thank you, Robin. Can I just respond, and then I'm going to open it up to colleagues. So we are Dorset NHS here. We're not Somerset NHS. So we're not here with the responsibility of the 1,200 births that were 1,300 births being delivered at Yeovil. We are aware that Somerset have been working with the RUH in Bath, as well as increasing the capacity at Musgrove. And the points that you raise around the reports at Musgrove are well known. We're not here to answer those because it's not our trust and it's not our service. So apologies, but some of those questions, I would argue, are for the Somerset Health and Overview Scrutiny Committee, and we're not in that system. And similar to you, I live very close to Yeovil, so it's very dear to my heart. I have both my children there, but I work at DCH. So at the moment, the expectation is that there's been an increase in capacity on the Musgrove site, but also conversations in the way that we've been describing we're having with Somerset with RUH and the Bath, because obviously there are women who will choose to go in that direction. And of course Salisbury, which has already been mentioned today. So there's a proportion that may have chosen Yeovil that will choose Salisbury. We also have a very active home birth service in Dorset, and we know that some of the resource that Yeovil have been looking at is increasing the capacity of their own home birth service in the Yeovil locality. But in terms of forecasting what's happening with births nationally, I'm going to hand over to Hannah, because actually there is a national trend around births that we also need to be cognizant of.
Thank you, Councillor, for your question. I think just to go back to where this started, and obviously Jo has already highlighted that we had very short notice on this. Somerset did provide some statistical modelling based on the maternities that they had booked at that time, and an estimated movement of those women across the different hospitals neighbouring Somerset County, which include Musgrove, Bath and Salisbury, in addition to Dorset County Hospital. That modelling looked at Dorset County Hospital picking up approximately 20%. That was a best projection possible at that time based on the locality of where people live. We know, as we've seen nationally in a number of different movements for maternity units, it's not just based on where people live. And I think we've covered that in depth today in terms of the choice and being able to manage that element of choice in terms of ladies when they have potentially a lack of confidence in their maternity unit locally as a result of CQC inspection, how that drives where they move to. In terms of the national picture for births, we've had quite a significant change in the past decade alone. So what we've seen is a national reduction in the birth rates. And we've had that in Dorset as well, potentially to a slightly higher degree. I think the data for Dorset suggests that our birth rates declined by about 5% over where it was before. And Dorchester County Hospital have had higher birth rates before, so they have an understanding about what that they can cope with in terms of those rise and peaks in demand. And we saw some of it nationally after COVID as well. We saw a national peak in the demand for babies post-COVID. In terms of the complexity, it isn't just about numbers, which makes it a little bit difficult to directly answer your question. So if we talked about bed numbers, yes, you could kind of work it in terms of just the individual birth rates, but what we've seen is a different acuity of women. So women are staying in some areas longer, because of the needs of their babies or because of the needs of the complexities of the mother. In some areas we see them actually stay shorter. So what we've seen nationally is a significant rise in planned cesarean section rates, for example, and as a result of those, most of those are done in a day case, not an overnight stay, so 24-hour stay now, whereas they would have stayed much longer before. So it's about, as Jo said, almost being responsive to that and understanding how many ladies that we come in, what's the demographics of those ladies, what do they need, what is Somerset still able to help provide, because it's not just about inpatient stays, it's about outpatients as well. And I know that that's difficult in terms of the fact that I appreciate that you want some very hard numbers, but there's an element that makes that very difficult to provide solid assurance on, because of we've only got an element of projective models rather than what's actually happening, which there may be a disparity between.
Can I add just, and please be assured that we are absolutely working on how to cope to provide extra capacity for the services that we are needing to provide for the women who have chosen our unit. But as Jo has said, we can't speak to what Musgrove Park are doing other than telling you what has been relayed to us in conversation. We can't speak to what the RUH are doing. As DCH, I can tell you that we are looking at different ways of working. We have business cases for increased staffing levels. We have looked at separation of elective and emergency work in order to be able to cope better with flow. And we are not in the business of providing care that we feel is unsafe. We are absolutely doing everything to protect the safety of the birthing people, their families and their babies here at Dorset County Hospital.
You want to come back, Robin?
Thank you. I think it would be helpful if, and you mentioned, I believe, that you were doing some modelling on where you think mothers will decide to go for birth, whether it's to Musgrove or to yourselves or to Salisbury or Bath. So it would be helpful if that projection might be shared with us so that we can see what the projection is and what assumptions have been made. As if you live within a short distance of Yeovil District Hospital, as I think one of you have said that you do, you will know that if you've got a choice in terms of geography and travel time, DCH is the preferred option because you can get there within about 30 or 35 minutes. If you want to head off to Taunton, to Bath or to Salisbury, you're quite comfortably off and talking of something in excess of an hour, depending on the traffic conditions. So there's a geographic preference for Dorchester, it seems to me.
There is indeed, Robin, and we know it. There's a reason why I work at Dorchester. So I think that modelling, we'll take that away and see if we can produce something that's easy to understand, because the modelling for us, this isn't all about births either. There are pregnancies that don't end in a birth. And so it's all about that early pregnancy support as well. And I know at the beginning, Councillor mentioned about bereavement services at the beach and over in UHD, and equally we will have families that sadly suffer a loss. So actually it's the whole extent of the service we need to be mindful of in terms of pathways and support. But as Audrey said, some of that is delivered out of hospital and not necessarily embedded care. So we'll see what we can do in terms of that in a way that might be easy to understand. But it is just modelling because women may choose differently for all sorts of reasons. So yes, it's our estimate of what we can anticipate as well as what we know has happened with women transferring to us already.
Can I just finally say that I know that you said that you're speaking here on behalf of Dorset. It would be good to think that you're working closely with your colleagues in Bath, in Salisbury and in Musgrove to make sure that this works, because it is it's a headache. So, since this has happened quite rapidly, it would be useful to know also whether you're working closely with the South West Ambulance Trust, because if an emergency occurs and somebody needs to get to hospital, are we going to see a lot of births somewhere on the road between one of those 4 different sites? And,
Thank you.
That conversation, I hope, is taking place.
Thank you. I was going to complete our answer here on behalf of the executive here at Dorset County Hospital, but also looking to my colleague Hannah from the ICB in terms of the fact that those conversations are absolutely happening. So my deputy yesterday was in a meeting with Somerset, with South West Ambulance, and other providers in the area, answering exactly those questions. And other than in the immediate aftermath of the closure, where we were all working as best as we could in an unknown situation, but after that initial day or two, SWAST have had no other incidents and are working very closely. We've made sure that all our 111 pathways are updated, and therefore, regardless of whether you phone 111 and pick up a local service or a national service takes your call, the pathways are really clear for advice. And as I say, assurance was given to the ICB from SWAST that all of that is working as it should. We will stay completely connected in those conversations throughout this period. So to come back to an earlier point, we meet internally on a Monday and make sure that we understand where we are, what else we've learned in the previous week, whatever we might need to escalate. We then meet with our colleagues from Somerset on a Tuesday and we bring that piece of work together. And then we are in constant contact through the working groups, whether that's the one led by Dr. Ryan here on the clinical pathways or on the workforce. And then we bring that back into to our governance, and then Hannah, Joe, and your counterparts in Somerset and the whole range that we've discussed today meet regularly as well as part of the whole governance. So that's absolutely in place, and we will not step away from that until this is entirely resolved.
Thank you. I'm going to move on now to our next speaker. Sally, you've been very patient online. The floor is yours.
Thank you. I think my concerns have been addressed actually with the last comment that was there, because my concern was that the 837 might become an extension of DCH maternity unit. But it sounds like that those have all been considered and thought through. So I won't take any more time. Okay, thank you.
Thank you. Vice Chairman.
Thank you. Councillor Jane Somper, Beacon Ward and Vice Chairman of this committee. A quick question. Most of my questions have actually been answered, so thank you for that. I just want to ask you about the holiday season, which is due any moment, although it feels like it's here already, and the increase of visitors to the area. And you have mentioned that, or you touched on that lightly, around those unexpected women who come into the service whilst they're perhaps here visiting. So what measures have you put in place, and do you expect there to be, that's clearly going to add, but is that of any significance? Bearing in mind you've got obviously this added pressure now from Yeovil not being open.
Thank you, Councillor. We are very familiar with an increase in activity during the holiday period, and it is for us business as usual. So the extra requirements to support families who choose to have their babies with us is the element that we are focused on, and we are the senior team in the maternity service are very much operational and regularly review bed capacity, staffing capacity, and we have a very flexible, both a very flexible workforce who can work in all areas, but also we actually have a very flexible estate where we can actually convert rooms as required from postnatal to a birthing room, from a birthing room to a postnatal room or an antenatal ward. And we have reviewed really carefully how we could provide some extra capacity. So, for example, we have a midwife-led unit, which is an alongside unit, and we have looked at how we could utilise those rooms in a very careful and safe way to provide more complex care if we ran out of beds on our labour ward. So I think the management of holidaymakers, whilst we're very mindful of it, is not something that is causing me significant concern. What we're focusing on is ensuring that anyone who chooses to use our service receives a high standard of care in the right area. And I think whilst we have had some challenging times, which I think you would find in all maternity services, we have managed them well and safely. And where necessary, we've worked with our neighbouring trusts to ensure that capacity across Dorset and sometimes across the region can meet the demand. Thank you.
It's worth noting, I think, the electronic record also supports any visitor.
The electronic record is
a game changer.
Yeah. Having the same record as Yeovil and most maternity services is extremely helpful for being able to meet a woman's or birthing person's needs really promptly, to be able to respond effectively, access the care that's required, and ensure that that's in place. So it has been extremely valuable.
So those in the council room may well know that for decades women have had handheld notes when pregnant. You'll have carried around a big book with all your pregnancy information in it. Nowadays, most women have an app on their phone which contains all of their pregnancy information, held by a platform which we can access centrally, which allows us to see all of the correspondence, the blood results, the scans, everything that's been captured in relation to their pregnancy and planning. And given that nationally now the spread of that platform is wide, it means that yesterday, when we had a very complex woman who was holidaying with us from Eastbourne, we were able to coordinate her care in a way that would have been really challenging just a few years ago.
Thank you very much. So you can assure us then that you don't feel that there will be at any point across the summer any form of crisis within that service in terms of capacity of consultants and midwives, and also your estate actually having the spaces and places.
Sorry, did you mean? Apologies. Our signalling failed at that point. Yes, the fact is that we've done the full risk assessment. We understand exactly how we can manage our resources, how we can flex our resources, but we are also part of a network that, if necessary, we call on our neighbours and we work together to do so, which again is business as usual in terms of managing the fact that a surge can happen in any maternity unit within the network at any point in time, and we are then aligned to support whichever unit requires it.
Thank you. You mentioned as services within Blandford Community Hospital for those in the north of the county, and I represent an area in the north of the county, so I didn't quite understand what that service was there that you were able to. Was that sort of scanning?
Yes, we've always had an ambition to try to make the pregnancy experience as easy as possible, and whilst it is the case that complex clinics need to be centralised, and therefore the most complex women will need to come to antenatal clinics at Dorset County Hospital, there are some women who require consultant input but aren't placed within those highly complex clinic loads, and so we run community clinics, consultant-led antenatal clinics at Weymouth Community Hospital and at Blandford Community Hospital. We are also able to provide scanning, and we can take bloods within within Blandford. And what we are trying to work towards is a recognition that we should be able to work with Yeovil to do something similar as we've been doing in Blandford, such that women can have their scan or have their bloods more locally to where they live, thus saving on travel time and expense. But then they are still able to be escalated for an opinion from a doctor if required, which might require them coming along to Dorchester. And that's how we've been running the service in Blandford for years, but we would like to be able to move towards doing that for the Yeovil population also.
Thank you. I'm going to move on to our last speaker now, Andy Todd.
Andy Todd, Coal Hill, Wimborne, Minster East. This is not my specialist subject, you'll be surprised to learn. So I beg your indulgence, if I may. I've got 2.5 questions. Councillor Sumper's already asked, and a lot of the answers have already come through on my first question, for which I thank you, because you say it much better. But I'm a simple soul, and the general public who might be watching this online might appreciate a shorter answer. Is there sufficient capacity within Dorset to accommodate 250, assuming that's the uplift that we're going to see, 20% of the total, I think you said, within Dorset, and to deliver the same quality of care that we've been getting up to this point? And the half question, what if this isn't a surge? Surges have a habit of depleting resources, wearing staff out, reaching the end of their tether. What if this is something that we have to live with for longer than 6 months? Is there planning in place to increase our resources? And secondly, will the additional distances that mothers have to go cause a negative impact on outcomes? Is the only polite way I can put it. Can you assure us that that won't be a problem? Thank you.
Thank you so much for the question. So the very short answer is this. We do require additional resources. We do. We're working closely with Somerset so that their staff, as we've mentioned, can come and work here to provide us with those additional resources. And we're working with the ICB in terms of the financial impact of those additional resources. So we are already putting those resources in place. We have to. There are more births. So we are doing that. And so the assurances are, we're really clear what we need. we have the cases ready to discuss, and we're working with Somerset on the additional personnel to provide that consistently, and not just relying on our own teams to just step up as you suggest. So we will have additional capacity, we'll have additional personnel to do that longer term, and we're very, very, mindful of the fact that while the unit may be closed for 6 months, the legacy of that closure will go on for longer, and we have to plan accordingly. So yes, I can give you those assurances. In terms of outcomes, I'm going to look to my clinical colleague, if I may, because...
So there was a lot of modelling done at the time of the clinical services review for Dorset, looking at travel times relating to moving births from Poole to Bournemouth. And in terms of the travel times involved, in general, we would still be expecting average travel times from the Yeovil area into Dorset County Hospital to be within that envelope, the same envelope that we're suggesting for the Dorset population who are travelling either to Bournemouth or to Dorset County Hospital. And so, whilst it is the case, and anybody will tell you this, that if they are having a concern about their pregnancy, it would be lovely if the hospital was just round the corner. The way our geography works, I don't believe that we can say that this is a significant concern. And we are doing everything to mitigate the risk provided in the scenario that we've been presented with. The mitigations include, for instance, ensuring that we are cognizant of where a woman lives when we think about admission, ensuring that we put robust plans in place so that we're protecting women in advance, and making sure that there are firm and clear plans of what the timing of events in pregnancy should be. Now, I would go back to my original statement, which is that it is a woman's choice as to where she gives birth. And we see women who choose to come to us from, for instance, Christchurch and the other side of Lyme Regis, and they have decided that they would prefer that distance. But in terms of the overall average times, I know that Hannah was involved in the clinical services review, as was I, and so there was a lot of modelling about transport times.
The only thing I'd add to that is we have a change in the way that services run even since the clinical services review. So as an approximation, at the clinical services review time, the amount of a planned activity was probably about 30%. In terms of women choices around the way that in terms of planned cesarean sections and inductions of labour, that is now up to and over 50%. So that also reduces some of that element of risk in terms of women travelling in labour.
That answer your questions? Okay. So we've heard an awful lot this morning, and I think we've had some really good questions from members of the committee. I think it's been very helpful to understand the picture across Dorset, as well as the impact of what's happened at Yeovil. I think coming out of what we've heard, we have got some reassurance about the measures that have been put in place to ensure the safety and well-being of the expectant mothers and their children. But I do think that obviously we're in flux a little bit because the inspection process, has an action plan. We're not privy to the publication of the document and so on. So it is going to be more of a journey. And I think it would be very important for this committee just to keep an oversight as things progress, because as has been mentioned by members of the committee, we need to know that what's been put in place is robust, and if, at the end of 6 months, the unit is unable to open fully, that the measures that are in place are sustainable and will be able to keep up with that. So can I suggest that we would like to see perhaps 6 monthly update reports on where the journey is, but also on the wider Dorset, where the individual trusts and hospitals are coming towards the end of their improvement programmes, that as they are re-inspected, that we are made aware of what those outcomes are, so that we can just keep, a watching tab on what's happening so that we are confident that the services for the people of Dorset are improving, because I think that's really why we're all here. Unless anyone thinks that I should add anything else into that about the way forward. Yeah. Yes, Jane.
I just want to recognise, really, I think, obviously, you were all put under enormous pressure without prior knowledge very quickly. And I think it's actually really impressive how you and your teams have responded. Obviously, nothing is perfect, and we know that, but I do feel reassured, actually, that certainly within Dorset, although there are issues, and we know that, that you've been able to pull your teams professionally together in this way to provide, what is, the most important service in a sense, bringing new lives into the world. So I just want to acknowledge that. Thank you.
Thank you very much, and we'll convey that to our teams. Thank you.
I think we'll all echo that. Certainly as someone that gave birth on an antenatal ward, I know what it's like. But I think finally, if I can thank you all so much for taking the time to come and talk to us. I know you're all in a really difficult journey, but thank you, and we appreciate you taking the time and being open and honest with us. And we look forward to the update reports.
Thank you very much.
Thank you very much.
Okay, do members of the committee need a 5-minute comfort break before we move on to the next item? No, I'm not seeing anyone desperate. Okay, in that case we will move straight on to agenda item 8, which is the update on our Education, Health and Care Plan Inquiry Day, which we held not that long ago. Yeah. Seems a lot has gone on, right. I forgot to bring my printed out notes, so that's why I've had to open it all up again. So we have a recommendation in the printed report that we note the report and that a further report of recommendations developed following further investigation by the panel. So you need to have some feedback from me as chairman of the panel as to how we found the day, which I have to say was intense. I think we went back to back virtually from first thing in the morning to about 3:30 when we all died of sheer exhaustion. But I particularly want to thank all of the officers and the partners and the parents who participated in the day. And I have to say, my intention was to do the whole thing in one day and come out with a fantastic outcome. And that really was overambitious. We heard so much information that it's taken an awful long time to sort of sit and let it filter through and work out where we need to go. So we're not ready to produce a final report yet, but looking at the feedback that we've had from the day, we are developing a few themes that we need to inquire further on. The first one being is communication. That was something I think that we heard in virtually every session, was the importance of the need to improve communication with parents and children, and including the voice of children and young people, because we weren't able to hear that on the day. We heard from staff that are involved in working with our young people, but we haven't actually had anything directly from young people about their views on the process. As regards health, our initial thoughts are obviously concerns on the timing and the content of annual reviews, the waiting times for diagnosis, particularly autism, because that is 2 years. Issues around assessments for children in care who are placed out of county or in independent placements, and health inequalities. We were also concerned about the effectiveness of joint commissioning funding and also medical absence certificates. The desire to have the right support at the right time, because if we get it right first time and we get it right as needs change, then that will save everybody time, money and pain, because it's those things, and I'm seeing, nods around the room, but parents just want what's right for their child when they need it. We also are concerned about the impact of delays on transitions to adult services, including birth to settled adulthood. As I just alluded to, partially budgets and staffing, because we need to get that right. Special educational need and disability provision, both mainstream and home education, and improved use of data for better outcomes. And then finally, the complaints and tribunals process and the implications for Dorset Council. I will in a minute ask members of the committee to reflect on the contents of the report you've got in front of you and whether you're happy that our scoping is sufficient. But when we do take this forward and start to look at these areas in perhaps a little bit more detail, there are some of the things that we need to take on board because of the changing landscape. Directions coming from central government regarding partnerships and joint initiatives, particularly with health and families, funding settlements and strategic alignment of resources to ensure that critical services are maintained. And that's not just nationally, that's locally within Dorset Council. The drive to increase mainstream inclusion rather than expensive independent sector placements, and the potential loss of the tribunals process and what will or will not replace it and how we move forward in whatever framework we have. There was also one item in the paper that we didn't touch on in the actual inquiry day, and that was about the increasing cost of SEN transport. And the paper quotes it as being in 2019-20, £9 million a year. In the last financial year, that had increased to 19.7 million. So I think, just given on that one statistic, that deserves some independent scrutiny of its own. So, George, can I ask you to put that on the forward plan, that we look at the cost of SEN transport? Yes. Okay, so I'm being advised that it might come under Place and Resources Committee, but whether it's us or them, I do think it's something that we need to shine a spotlight on, because for everybody, we can't have costs spiralling. So, members of the committee, over to you on what you see in front of you and what I've just told you about the inquiry day. Andy.
Andy Todd, Cohill, Wimborne Minster East. I hadn't expected to be the person to speak first on this subject, but here I am. Is there an opportunity to have a conversation with, for example, trusts and their involvement in supporting mainstream inclusion for children? I didn't see any mention in there of trusts being dealt with separately or differently.
Are you talking about academy trusts? Yeah. So we did have a session with people from a variety of staff from schools, SENCOs, head teachers, from both academy and maintained schools. And there is quite a full section of their responses. One of the key things they were talking about was the role of SENCOs and head teachers, and where some of the reports need to be done. I haven't got the detail in my head, sorry. But it was about being able to allow SENCOs to take some of that strain off the head teachers in providing some of those update reports, because at the moment I think it has to be the head teacher that provides certain information, and sometimes it's easier within, I'm sure people will correct me if I've remembered this wrong, but being able to get that information returned quicker for assessments. The other thing that they also were concerned about was the rush at the end of the summer term to try and get young people identified as being in need of further support at the start of the summer holidays, ready for the following September, and how suddenly young people appear out the woodwork that they weren't aware of that would be coming in, and having to deal with all of that in a really tight time scale. I don't know if that partially answers some of your queries.
I think my approach was slightly more prosaic than yours. It's more about the delivery on site, the actual support being provided to children. It's one thing to have a plan, it's another thing to execute things on in reality. And all children that fall out of their natural age cohort and are progressing at a different speed do not appear at this point to be able to continue within the mainstream. And I'm just interested to know whether there's any thought there, because once you exit your cohort, it then becomes more expensive for council to provide support. So I'm interested in the number of options, and they all progress at different speeds in where they are emotionally, intellectually, and so forth. So I'm interested to know whether there's any big work been done on that. And I apologise if I am rehashing things that you talked about at length. I wish I had been there for it.
I'm sure if you've been on the committee before, we would have included you in the panel. You never know, we might invite you to join the next round. Do you want to give a response?
Thank you. Beth Whitaker, Interim Corporate Director for Education and Learning. I suppose just coming back to your point around trusts and schools and LA maintained schools. With regards to special educational needs and disabilities and needs assessments, we work across the whole system, so we don't differentiate between whether a school is a trust or an LA maintained school. So our SENCOs, the SENCO network is open to all of the SENCOs across all of those different provisions. And some of the work that we've been doing, particularly with Empower, to increase expertise in schools has gone across the system. And then we have, each school has a planning meeting with our specialist teacher, which is an opportunity with the SENCO and other members of the school team to come together to discuss children that they feel might have needs met in a different way. And that meeting takes place once a term for every school in Dorset, regardless of whether they're part of a trust or whether they're not. So.
I think to answer your question sort of completely, you will need to have sight of some of the raw data that we saw at that panel. So I'll get that circulated to you. Are members of the committee happy if we add Andy Todd to our work panel? Yeah. Thank you. We'll do that moving forward then. Are there any other comments for today? Carol?
Thank you. I mean, you obviously had a full-on day and you covered everything in great detail, and my hat's off to you. It just strikes me that I think East Sussex seems to do pretty well, and I wonder if there's any learning tools we can take from them. And looking at it, really, we just need more specialist places, I think. I think we were hoping more from Coombe House, and I just wonder whether that could play into, could we do more at Coombe House in terms of cutting down our transport costs, certainly because it's in Dorset, and perhaps giving people access to the education they need.
On the subject of Coombe House, I know that it's becoming more and more popular, and I understand that other authorities are now looking to send their children to Coombe House, which is, I think, a compliment to the success and how much they've grown in such a relatively short time. And they are growing our own in Dorset numbers, but I think I'll leave it to Beth or Paul to speak more widely on that.
Thank you. Paul Dempsey, Executive Director for Children's Services. Yeah, I'm pleased that you noted that graph, that bar chart that showed East Sussex at the top there, performing on timeliness, just above Dorset second. So our performance pretty strong compared to those comparator groups and national averages. But yeah, if there's an opportunity to learn from East Sussex, we'll follow that up and take that up. On the question of Coombe House and extra places, Coombe House is just one of our strands in our school place sufficiency strategy. So we have many things to consider when we're looking at sufficiency of school place. One of them is the needs of children. One of them is a geographic consideration. Where do those children live? Where do the school places need to be? So we need school places that meet our children's needs in the right geographical locations where possible. That will impact on the school transport costs. So Coombe House has done a good job in providing a good number of places, I think about 120, 130 places at the minute. We are continuing to develop our sufficiency strategy, and Coombe House is one consideration of many different options about increasing places. We do need more places, yes, and we're working through our strategy to deliver that. We have a number of proposals that have been completed and a number of further proposals that we're looking at to develop over the next few years.
Thank you. Can I just ask, what capacity do we have? Is there any capacity in any of the schools for extra places within the next 3 months for children with SEND? Is there spare capacity in any of the schools?
Thank you for your question. It's very much a moving feat, and I'd have to come back to you with the exact details of each school because I don't just have that to hand, I'm afraid. And I just want to clarify, was it within specific reference to our special schools, our maintained special schools? Yes. Thank you.
Okay. Bridget.
Maybe Beth Whitaker, Councillor Bridget Bolwell, Bridport Ward. Perhaps Beth Whitaker would like to comment on the fact that not all children with SEND need specialist places, and how with projects like VSEND with Empower, you're really upskilling schools to actually be able to manage children and young people with SEND that do not necessarily need a specialist place.
Thanks, Councillor Bolwell. Yeah, so that's part of our work. Another part of the work is we've been doing lots of training in schools around autism. We've also been running Elkland training, and our agenda is very much in line with some of the national SEND reform around children being able to access their local school. We also, following on from the point around Coombe House, and in terms of specialist provision, we have brought online a number of specialist resource provisions which sit within our mainstream schools, and these are specialist provision that enables some of our children with needs to have their needs met in their local school. As part of our ongoing sufficiency strategy, we are planning to bring online at least another 13 of these resource provisions, and one of the key benefits of these is that it enables young people to have not only access to the mainstream school and the facilities that that provides, but also to be kept more locally in their community, which ultimately cuts down on transport costs. So there are a number of different things and support that we are putting in place to support some of our colleagues in mainstream in developing the expertise to greater meet the needs of children with special educational needs outside of special schools. Another element of this is that we are also working as part of our Empower work to review some of our children who are currently in special schools, and due to improved outcomes, we are now able to identify that they might be able to move back into the mainstream system, which will then enable more spaces to become available in our special schools for those young people and children with the highest needs.
Vice Chairman.
Thank you, Jane Somper, Beacon Ward. So having been very previously complimentary to the NHS in the previous item, I'm afraid I'm a little less complimentary in their work in this space. I know they're trying the best that they can with the resource that they have, which is clearly pressured. Everyone is pressured across the board. But leaving families and young people for several years waiting to have a diagnosis, in my mind, is not acceptable. And I was not satisfied with the response that we had, which was basically, that's the way it is. We are, we don't have capacity, and they've got a huge waiting list. And I feel that, the work within children's services is clearly highly ambitious and doing some innovative things within schools, working with schools. The relationship with our schools appears to be strong, and I felt a good sense of that. Okay, there are always room for improvements in all of these areas. But I do feel that, and obviously the NHS are not here to respond, and I'm sure that they would want to, but I feel that's very much a weak spot within this system, which is, under enormous pressure anyway, and it's not helping really. They are doing, some work around speech and language, which is obviously helpful and important. But just this waiting time, and I know it's not just in Dorset; it's a nationwide issue, and I know also national government are obviously looking at ways to deal with some of this. But when you've got a waiting list of, I think it was 2,000, that's going to take quite a long time to get through. So I just leave that there. It's obviously no one can really respond, and I'm not expecting children's services to respond on behalf of the NHS.
There's not really much I can add to that. So, Robin.
Thank you, Robin Degg, Sherborne Rural. Can I ask a question about the finances? There's some very scary numbers floating around in relation to finances. What happens next year if we haven't at that stage agreed a new rolling over or funding mechanism for what is basically a £50 million increase in the dedicated schools grant?
Thank you, Paul Dempsey, Executive Director of Children's Services. We don't know what government plans are for March 26, when the current statutory override position ends. We do know, and our Finance Director would be better placed to advise you than me, we do know that our deficit is close to 95 million. And our reserves are, I think, about 100 million. So we're that's not a very comfortable position to be in. We're not alone across the country. There are many, many councils nationally in a very similar position who would ask to be serving notice of bankruptcy or near bankruptcy. So we're waiting for the government to come back to us and the rest of the country on a position, but it's not a very comfortable position to be in as we stand. So I think that would be a pretty similar answer that our finance officer would give, perhaps a bit more detail, but we're all waiting anxiously and hopefully for some resolution from national government about that.
Do you want to remind us when we expect to get the figures for next year? Does it come as part of the main settlement to local government, sort of December time, or do we get it earlier or later? I can't remember.
Are you talking about the designated schools grant? Yeah, that normally comes round. We normally get a notification of that in the autumn term. So.
Does that answer your question, Robin? Carol?
Sorry, I just wanted to come back following on with Councillor Somper's mention of waiting for autism diagnoses. From personal experience, I don't know whether this has any play into anything, but I just wonder whether we might be able to do something with it. Working in our local family hub, there are parents that are waiting for diagnosis of ADHD. And quite honestly, when you look at some of these children, they're just normal, boisterous children. And I wonder whether there is any work we can do to say, well, look, you know, just because you want to sit and look at your phone quietly for an hour, your child needs attention and needs to play and is absolutely quite normal. Are appointments being taken up needlessly by parents thinking their child is just too boisterous for their own personal way of life? I'm just going to put that out there.
Go on, Paul.
I won't particularly attempt an answer to that question directly, but I would just say that we and our partners are endeavouring to meet children's needs all of the time that they're waiting for a diagnosis. So we are meeting need as best we can. We're not waiting for a diagnosis before we attempt to look after that young person and meet the needs and the needs of that family in relation to those needs.
Then in which case, is it possible that family hubs can have a resource to have somebody in perhaps once every month, six weeks or so, just to talk and reassure parents that perhaps this isn't a path they need to go down, because that must be saving appointment time and needless worry? Just a thought.
I think, I won't ask you to respond, but maybe there's something, take it away. Okay, I think we'll leave it there for now on this, because we do have some more work to do on those themes that I talked about at the beginning. Do you think that, Bridget, as you are a member of the panel...
Councillor Bridget Bolwell, Bridport Ward. Just as a last thing, I wonder, it may be Paul Dempsey that just comments quickly for my colleague here about, I believe there's a limit that's been put on the amount of children or a young person that can go to Dorset School of Excellence, Coombe House, out of county. Is it something like 20%? So it will not be like they take more children from out of Dorset.
Thank you. Yes, that is correct. The contractual arrangements are that Dorset Centre of Excellence are only allowed to take up to a maximum of 20% children who aren't Dorset children. And notwithstanding that anyway, they are committed and striving to provide school places for Dorset children, not children from elsewhere.
And currently it's only 4%.
So if the committee are happy with the lines of further inquiry that we want to undertake. The panel will meet again and we will do some further investigations along those lines of inquiry and hopefully, probably be the autumn now, but bring back a final report at that point for you to scrutinise. Thank you. Yes. And we'll take a 10-minute comfort break before we do the rest of the agenda. Okay, thank you very much. I trust everyone is suitably refreshed. We're going to move on with the agenda now to item 9, which is the impact of the cost of living support programme 2024-25. Laura Cornett is in the room, and I believe you're going to take us through the report. I do know that the portfolio holder, Councillor Ryan Hope, wanted to be here but cannot for work purposes, and that Councillor Jill Taylor will be reading a statement on his behalf, and I'll do that once Laura has introduced the paper. Okay. If you're both happy, then I'm more than happy for you to read the statement out first.
Thank you. I'm Councillor Jill Taylor. I'm a portfolio holder for Housing and Health, and I'm speaking on behalf of Councillor Ryan Hope this morning, who's the portfolio holder who covers this area of work. And he says, and I'm reading verbatim, "Unfortunately, I'm unable to attend this morning's meeting, but I'd like to offer this short statement in support of the discussion. Today's committee is being asked to review progress on the £2 million investment in cost of living support agreed in July 2024, following a request from the Place and Resources Overview Committee for regular updates. In response to the Chair's submitted question on the 25-26 budget, I recognise this is an important point and I would like to offer the following clarification. The £500,000 funding for the 25-26 is not a cut. It is the first time this work has been supported by a dedicated recurring budget, which has been formally committed for the duration of this Liberal Democrats' term. This gives long-term focus and reassurance to residents, officers, and the voluntary and community sector. When combined with the Household Support Fund, total support could reach up to £1.6 million, ensuring continued delivery of vital preventative services across Dorset. This shift away from one-off use of reserves reflects a more sustained and transformational approach, one that continues to support those in need, but also helps people move away from crisis and build more independent lives. We're managing demand by aligning this work with the Household Support Fund, avoiding duplication and making best use of available resources. If new or urgent needs arise, we will monitor closely and bring proposals for additional funding to Cabinet if needed through the Priority Fund. Including through the Priority Fund. To be clear, today's meeting is not the forum to debate or scrutinise the 25-26 delivery plan or budget. The purpose is to review the impact of last year's investment. Any wider budget conversations should take place through the appropriate channels. Looking back at 24-25, this programme was truly transformational. It supported over our most vulnerable residents across Dorset and helped focus from emergency response to prevention. For example, social supermarkets give people a route out of poverty, helping reduce reliance on food banks and supporting long-term food security. The programme also strengthens local partnerships and builds the capacity of community groups, delivered high impact at low cost by working through trusted local networks, enabled more self-sustaining models of support, reducing future dependency on council funds. Although the programme was funded from reserves, which are not a long-term solution, only 1.26 million of the 2 million was spent. This underspend reflects the fact that several projects were delivered using alternative funding routes, such as the Household Support Fund, ensuring best value for Dorset's residents' money, particularly their council tax contributions. In addition, a proportion of funding was deliberately unallocated and earmarked to step in if central government cut HSF support, especially to safeguard half-term holiday, half-term school meals and activity provision. Fortunately, this scenario did not arise. However, this contingency planning reflected a key priority of the Place and Resources Overview Committee, ensuring Dorset was ready to protect vulnerable children if national funding was withdrawn. I'd like to give particular thanks to Laura Cornett and her team in Communities and Partnerships, and to all our partners in the voluntary and community sector, whose dedication helped deliver real change for thousands of residents across the county. Finally, I strongly encourage committee members to review Appendix 2, the infographic summary, and Appendix 3, the full impact report. Both clearly demonstrate just how impactful, efficient and transformational this programme has been. Thank you.
I've was sent a copy of this morning while we were doing one of the earlier papers. I will leave most of this to Laura to pick up with her report. However, I do need to make one point. Under the local government legislation, it is not for the executive to tell Scrutiny what they can and cannot do. We have a free roving mandate to look at what we will. And we will. If we feel that there needs to be scrutiny of this year's budget as well as last year's budget, we will do that. Laura, over to you.
Thank you very much, Chair. Okay, so firstly, apologies for the length of the report and the appendices. However, I wanted to present to members of the committee the full picture of the provision and the impacts and outcomes of our investments to our most vulnerable residents and communities during the last financial year. I've included the background to the Dorset Together cost of living programme in my introduction, with a full list of all its funded projects, which can be found in Appendix 1. And of course, all previous committee papers are available in the background papers for those newer members. In number 2 of my report, this details the importance of the programme, with the main aim of the programme being to alleviate the financial pressure on vulnerable households. This has been delivered by direct support, such as food vouchers, energy bills subsidiaries, rent assistance, to help our low-income families and individuals to meet their basic needs. In turn, it's helped reduce the risk of debt, eviction, food insecurity, as well as reducing stress and anxiety associated with financial hardship. Of course, it also has given us better access to healthy food, heating, and housing, which leads to improved physical and mental health outcomes. The programme has always aimed to ensure that resources are distributed fairly, prioritising those in greatest need and fulfilling identified gaps in other welfare support. The programme has wanted to adopt an early intervention approach with the aim of preventing more costly outcomes later on, such as homelessness and debt. In return, this obviously will help reduce pressure on public services, such as our social care, healthcare, and of course, emergency housing. The programme has always taken a collaborative approach, which not only enhances the effectiveness of interventions, but also strengthens our community resilience in the face of ongoing economic pressures. And its continued support is crucial for ensuring that all residents can navigate the financial challenges posed in the current economic climate. Hopefully, members found the infographic in Appendix 2 useful, in addition to the full project reports as a summary. Yes, so I wanted just to quickly talk about in 4.5, I mentioned there was a risk that the national government funded household support fund will not continue after the current financial year. Earlier this week, we had notification from the DWP, Department of Work and Pensions, that there will be a new crisis and resilience fund to replace the household support fund, also combining the discretionary housing payments which received to our revenue and benefits team. We're now waiting on further details on what this includes, including the financial details of this. In addition to my report, the chair of the committee has asked me to extend on some of the cost-benefit elements directly to Dorset Council of these investments and how they've been achieved. My team have prepared some supplementary information specifically for this on 3 of the projects, which I'll make available with the minutes as well. So the first project I'd like to just go into a little bit more detail in is the homelessness support, which is project 1. So recent research by Crisis and the Local Government Association have shown the cost of supporting households who are made homeless is up to £25,000 per household per year. So using a midpoint figure of £15,000, because obviously the 25,000 does include things like London Waiting, in the last financial year, our investment of between the 2 funds, Cost of Living and Household Support Fund, of 317,000, we supported 188 households from being made homeless. Using the £15,000 figure, this would have cost £2,820,000. So the return on investment is £19 to every £1 we've invested. Project 3, the Citizens Advice Specialist Debt Caseworkers. Although the cost is very similar, having 4 debt caseworkers outside the organisation to having it within Dorset Council, by hosting it with our strategic voluntary sector partners, these vulnerable residents benefit from full wraparound support for wider issues, and it's much more supported by their volunteers. And it also includes things like the established referral pathways, which we work with all of our family hubs and other voluntary sector organisations to ensure people are getting help much earlier. Some of these services, like Citizens Advice, are often seen as more approachable by some of our vulnerable residents, particularly our marginalised communities, because sometimes they have the distrust of formal organisations due to things like mental health issues or homelessness. Also, there's an investment here in preventative support for longer-term social value. And the third one I'd like to mention briefly is Project 11, which was our project to support older people in applications to receive the right benefits. So the last financial year, we supported 502 people to receive telephone support, and 342 people have received face-to-face support within their homes to access benefits that they are entitled to. Each of those individual visits takes a minimum of an hour, usually 2 to 3, to complete. A large majority of these applications have been successful, though we are still waiting on some of the outcomes. And this has increased the value of £388,000 to these Dorset residents as a total. So the return on investment there is for every £1 we have invested, we're getting a return of £5.70. As I mentioned, I will provide this supplementary information as part of the minutes. And that's the end of my introduction. I'm looking for questions. Thank you, Chair.
Thank you very much, particularly for highlighting those particular projects. So, despite what was said in the statement, one of the key concerns has been this issue of the change in the budget and the impact that will have on the most vulnerable families. So even if we don't discuss it today, I think there is enough concern going forward that we continue to have 6 monthly reports so that we can monitor how that spend is being done and the impact that it's having. And particularly to understand the implications on other service areas and budgets where there's a difference in the programmes that are being delivered and what wider risk there may be to Dorset Council. On the question of statement on the level of budget in the statement, where saying that with the addition of the HSF to the this year's budget of 500,000, that it takes it up to almost back up to the £2 million a year. looking back at last year, we had the 2 million plus the HSF on top, so the spend was far greater. So in real terms, you can't double count the HSF. Laura, you want to respond to that?
Thank you very much. So when we allocated the budget in June last year, we allocated, I think it was just under £1.5 million, not knowing what the Household Support Fund was going to be doing. So we left £500,000 as a contingency for that. And as Councillor Hope's statement said, then that was subsequently then filled in with the Household Support Fund with the announcement of its extension for the last 6 months. In addition to that, the Household Support Fund were then able to fund some of those projects, or partly fund, which I've identified in the appendix. So we actually spent £1.2 million. So this year we have got an allocation of £500,000 from the cost of living, plus working much closer with colleagues who are working on the Household Support Fund. They've given us a lump sum of 700,000, so we do have the 1.2 million. So there is a reduction in funding, but it's not 2 million plus. And then also in one of my, I think it was Appendix 5, I have listed the full Household Support Fund budget for this year as well, so to make it so it makes for clarity really.
That extra sum that you said you were given this year, is that a carry forward of the underspend from last year? So what's happened to that underspend? Has it been clawed back, or is it being rolled forward? How's it being used?
We offered it up as a saving, and I believe it has funded some of the adult services, the DIPS contracts, which are also adult prevention and early intervention programmes. So it has gone on the same theme. Obviously, we had to make some, as a council, they had to make some decisions last year about spending for the budgets. So that's where the last funding went towards that instead. But that was only after we gave it up as a saving.
Thank you for that clarification. Have we got any speakers yet? Chris.
Thank you. Chris Kippax, Minster Ward. I'd just like to make a brief comment on the value of money spent on the citizens' advice. It seems to me that it's very important that is so well supported, because it's so productive in terms of enabling people to be assisted financially. The second point is just a question about concerning tenancy sustainment statistics. Just ask if it's known whether the West Dorset line, 34 households, whether that includes Sherborne as well. You might want to come back to me about that, and that's fine. Just it listed name is Dorchester, Bridport and Lyme Regis. I'm just wondering if there's a Sherborne element there too. Thank you.
I'll find out the fact on that and get back to you after the meeting. Thank you.
Carol.
Thank you. Firstly, I would like to extend my thanks to lovely Laura here, because the work that the team has done has been absolutely extraordinary. There's been such a great deal of need. And if I go right back to the pandemic times when everything was a crisis, now it's not so much a crisis as putting in place procedures and measures to help people get onto a better footing. But there will always be people that simply can't manage on their income. We're in an area where wages are low and rents are extraordinarily high, and people do struggle. One example is a family that we work with 3 children with an income of about £1,600, and their rent's £900. And it's just really difficult to make ends meet. So there is always going to be a need for additional help. It's good to see that the food parcels from food banks are going down, but I think they're going down because people are finding organisations like ourselves, like the Nest and so on, where they can go in and actually choose their foods and get fresh foods, and they can feed their children, and that alleviates that level of stress. But I wonder going forward whether what we actually need to do is to work out realistically, now that we're in slightly more of an even keel, what do we actually need? What do our residents of Dorset actually need? What do we need to put into our budgets? And is there a way of doing that? So I know we've had to reduce 2 million to 500,000, and we don't know what the government's fund of what's crisis and resilience. I mean, how do we help people just be sustainable and live a decent life and put good food on the table for their children? I just wonder whether we can find a way of saying realistically, what do we actually need, irrespective of what the budget says? What is the actual monetary need to make sure we can facilitate families living a decent, dignified life in Dorset? Can we actually work on that as a budgetary figure? Thank you, Laura. Love you.
That's a challenge for you, Laura.
Thank you very much, Councillor Jones. So first of all, to answer your first comment about some of our residents, even though they are claiming all the benefits they are entitled to, are still starting the month in negative, what we call a negative budget. So that bills going out equates to more than they've got money coming in. So this is mostly addressed through the Household Support Fund. So Appendix 5 does give you a bit of a breakdown for what their budget is being spent on. And so what we have done for the last financial year and are continuing for this financial year is we have a discretionary funds that sit either with Citizens Advice and also some of our other agencies. And these are very much targeted for those, so they're means tested for those who we know are most in crisis. So it means they are able to get additional vouchers and things. And of course, then this is backed up by the free school meals and holiday voucher scheme as well. So to ensure that those families are not just those families that are on universal credit, quite often it's the families just outside of that. So it gives our social workers, our schools, and our welfare officers, where they know their families and which families are most in need, the opportunity to add those vouchers in so those children don't go hungry during the holidays. When it comes to your question about what do our residents actually need, I do agree we are continually looking at the data we are receiving. Unfortunately, some of the national government data is now several years out of date. So we have recently had some very interesting conversations with our data experts in the team. So it has become a little bit harder for us to really work out what people do need and what they are getting in. However, our data team are very much working on that. But I do agree. We want to be as targeted as possible. We want to make sure all of our funds are going to those most in need and most vulnerable. So we are always looking at ways. So with our partner organisations and within Dorset Council, and using that data nationally and locally as well. Because obviously Dorset is quite unique in our makeup. We have lots of rurality, which often is hidden deprivation. Or what we call asset-rich, families and things. So we are always working on how we can target those most in need. Thank you.
Does that answer your question?
Yes, I'm happy with that. But I just wonder whether we can make a recommendation that as a council we actually discuss a forward budget of not what we can afford, but what is the actual need, and then we can just see where we go with it. It's just understanding what that is in a monetary figure going forward.
Yeah, I think it's on all councils to look at the needs of their residents and those outcomes before we look at perhaps some of the more would like to haves. We need to get the basics right, because if we support our residents when they're vulnerable, then they are able to pay back into society and help grow Dorset. Are there any other comments on this? Yeah, Vice Chairman.
Thank you, Councillor Jane Somper, Beacon Ward, Vice Chairman of this committee. Thank you, Laura. It's a very detailed report. I'm sure it took you a very long time to do it. Just a couple of questions. The revenues and benefits section, the discretionary housing payment allowance and homelessness support. Could you just I'm just trying to understand the difference. Obviously, I understand the importance of the homelessness support. It's a vital service, but it seems a slight crossover, and so I just need to understand that.
Certainly, I can answer that for you. So both our revenue and benefits teams and the discretionary housing allowance are both programmes that are set by government. They have very, very strict criteria on who is eligible and who is not. The two work together, they almost dovetail. So some of our residents are eligible for the revenue and benefits support, and then others that are not eligible for that would then be eligible for the discretionary housing allowance. So it's the way national government set up those two schemes. I think the new government have recently identified some of the nuances of this, because in the new crisis fund they're setting up, they are including the discretionary housing allowance. So I have a feeling after this year, that will change.
That makes sense. Just in terms of, sorry, I just have to find my place and my cursors.
Yep. While Jane finds that information, can I just ask a supplementary on that? Because the number of times we've seen when governments say, yeah, we'll put these two funds together, and then we find that endorse it, we end up getting less. Do you have any feeling in the runes that, of where it's going for us? So are we going to be better off? Are we going to be the same? Or is it going to be business as usual and we get less?
We've only received the introductory letter, just notifying us that there will be a new scheme this week, which I'm obviously happy to share with you. There's absolutely no details at all yet available. We're obviously very hopeful it'll be at least currently the same as what we're currently receiving. But of course, until we have any details from them at all, we can't say. I'm happy to provide a report as soon as we do have a little bit more clarity. I know our housing teams and our household support fund teams are very eager to find out, so we can start planning for the next financial year.
Have you got what you need now, Jane?
Thank you. Sorry, just scrolling through your very long report. Just another question on homelessness support. That's not funding a capacity, an additional officer within the system. It's just to provide those items which are listed.
So under Appendix 4 for this year, it lists the 4 areas that the funding is going on. So one is for arrears and rent in advance deposit payments. One is tenancy sustainment, and that is part of a post that is working out. There are several posts that are tenancy sustainment officers, which our housing teams have received external funding from various sources, but this means we have full coverage across the Dorset Council area to be able to offer that, and it's enabled our housing teams to really get on the front foot. So obviously the results being last year, 188 families were supported from not being homeless, and that's very much down to those posts that we have, because they are on the ground working with those private landlords in particular, and being very proactive with the negotiations. The other 2 areas obviously are media and information awareness, so it's encouraging people to come forward before the crisis point, so before they are actually made homelessness, and that we do know that was incredibly successful last year. And of course, lastly, for those residents who are not eligible for any other kind of food vouchers, when somebody does present as homeless, it enables our housing officers to be able to give them a small voucher that will get them some essentials for that, either for that weekend or something. And once again, feedback from our housing teams is that has been absolutely invaluable over the last year to supporting residents who were not eligible for funding elsewhere.
Thanks, Laura. I mean, I'm fully aware of the importance of the work of that team and the success that has and what that means on a wider social scale. So I don't have an issue with that. It was just to understand whether or not that's actually, and I think that's £43,000 for a sustainment officer. I'm not quite, just to be clear, I see that in Appendix 4. The other point or question I wanted to ask, going through again, is around, can I find it? Sorry, Chairman, I can't find the section that I wanted because there are so many papers. Does anybody else want to?
Bridget, you wanted to come in, and then we'll come back to Jane.
Councillor Bridget Bolwell, Bridport Ward. Just around in item 6, lendology. So just one question, how do people know about lendology, CIC? Is that through CAB or how do they find out about that? And also, I take it this is for people who own their own properties.
Thank you very much, Councillor Bowell. So Lendology is available on it's advertised on our website, and also all of our referral agencies like Citizens Advice are aware of that. It can be used for either private landlords, obviously, then the teams will always get the permission of the private landlord, as well as those that do own their home.
Jane.
Thank you, Chairman. I found it. My little notes all over the system. In the tenancies to sustainment statistics, just on the not known, recorded and outside area, what does that actually mean in that table? That's on page 93.
I would have to confirm, but I believe it will be our residents who then resettle outside of our area. But I can confirm that and come back to you on that.
And that's the not known recorded ones as well?
Yes, I will. I'll get back to you on both of those points. Thank you. Apologies.
I'm just checking online. Are members of the committee happy with what you've heard so far? Okay, so thank you very much, yes. Laura. But we will ask for 6 monthly updates going forward, both for the rest of this year or scrutinising last year's budget, as well as starting to look at this year's budget. And the key thing, as I said before, is the impact on the most vulnerable residents, because that's got to be our underlying duty. Thank you. Okay, item 10 is the Community Safety Annual Report, or Annual Scrutiny Report. And I can see him at the back there. Andy Frost, hello, welcome.
This is Andy Frost. I am a service manager for community safety based in the Adults and Housing Directorate. So every year we come to this committee with our annual community safety report. It's one of the functions of this committee to be the Council's formal crime and disorder committee and to hold the Council and partners to account for delivery of their statutory functions relating to community safety. And we fulfil those functions mainly through the Dorset Community Safety Partnership, which again is a legal partnership comprising Dorset Council, Dorset Police, the Probation Service, NHS Dorset and Fire and Rescue Authority, plus some other organisations including the Dorset Domestic Abuse Forum, the Office of the Police Crime Commissioner and Youth Justice Service. And there's an awful lot, actually, of functions placed on community safety partnerships. The number have grown over recent years. So I divided the report into some of those main statutory functions. Community Safety Plan, which is a 3-year plan we have to produce. We're in the final year of our current plan. It was refreshed in March. There's 5 priorities and 4 cross-cutting issues, all of which are set out in the report. And I've listed some of the initiatives driven by the Community Safety Partnership. Now, these go beyond just annual plans. They are kind of more mainstream practice now in many ways. So high-risk domestic abuse is a multi-agency panel that comes together to look at high-risk cases of domestic abuse. We've recently recommissioned our integrated domestic abuse service. We run numerous communication and awareness campaigns around things like sexual offences and domestic abuse, and there's various other things that you'll see in the report. I've included some top-line performance information, and those statistics are for the Dorset Council area. What I would say is from the next meeting, this committee will have quarterly updates on a wider range of measures as part of the corporate performance reports, and that will include a narrative in relation to those as well. So there's an opportunity for the committee to track actually progress against some of these things. And those measures will include antisocial behaviour, repeat victims of domestic abuse, repeat perpetrators of domestic abuse, stalking crimes, sexual offences and violent crimes. So although we come here annually, there is an opportunity for the committee to look every quarter at how we're doing against some of those issues. Reducing reoffending strategy, latest strategy covers 2024 to 27, formally adopted by Dorset Council back in October. That's one that's pan-Dorset because actually some of the work that we're trying to do there just makes sense to do across the pan-Dorset, and most of the agencies responsible for reducing reoffending are organised on a pan-Dorset basis. We then have the Dorset Serious Violence Strategy, which is a fairly new requirement for partners to undertake a needs assessment and have a serious violence strategy and a serious violence partnership. And that, along with the domestic abuse strategies, is one of the things that we've been really careful to not create new structures and duplicate workforce. So in some other areas, they have created separate partnerships for serious violence and domestic abuse, whereas actually the partners are the same as the community safety partnership. So our CSP actually adopted those functions and made sure that any needs assessments and strategies aligned with our overarching community safety plan. And you'll see the serious violence strategy has priorities and a list of initiatives, and that's set out in the report. Domestic abuse strategy is a separate requirement for the council to have a domestic abuse strategy and a local domestic abuse partnership board. As I've said, we've wrapped that into the community safety partnership just to be more efficient and effective. It just makes sense to do that. And then the final thing in the report is around domestic homicide reviews, which is where we have to conduct an independent review into a death, if that death where domestic abuse may have been a factor in that death, whether that's a homicide or a suicide. It's a really very sensitive area of work, as members can imagine, and we have to follow strict statutory guidance when completing reviews. And the reviews aren't about apportioning blame, they're about identifying opportunities for partner organisations to improve and develop their service offer. Each review produces a number of recommendations, and those recommendations are regularly reviewed by the Community Safety Partnership. I think that's it by way of an introduction, Chair, but happy to take questions.
Thank you very much, Andy. Very concise report. Jill, as portfolio holder, is there anything you want to add at this stage?
I hadn't intended to speak, but yes, I will just add a little bit that I just want to make it quite clear to the committee, if that is all right with you, Chair, that these documents are all partnership documents that are all basically approved through a document, through the CSP and through a lot of partnership meetings. So please scrutinise it, please take it to bits, please look at it and give us feedback, and we'll put that feedback into the next reviews. In the meantime, I'd like to thank Andy and his team for all the work they've done on this and all the work they do throughout the year on keeping all these partnerships together and basically coordinating them through the Community Safety Partnership, which saves our partners an awful lot of time. And it's a really good, vibrant little group that's going at the moment. Thank you.
Thank you. I think you're completely right. The way forward has to be partnership working. You know, the landscape has changed. We can't all just act in our own little silos. We've all got to work together to make change and make things better. Jane.
Thank you, Chairman. I'm aware that Councillor Taylor needs to leave. And I wanted to ask about a hate crime strategy, which I don't believe is within here. And I don't know if it's embedded within the system, but because you have to leave, I wonder if we could just arrange to meet and have a discussion about that with officers at your convenience. Because I'm more than happy to meet to discuss any of the aspects of this. I think that would be really, really useful. Can I just hand over to Andy just to see whether he has any update on that for us?
Thank you, Chair. Hate crime is one of those things that we do monitor, and we do have partnerships in place to come up with initiatives in response to that. But happy to meet up and talk about that in a bit more detail. I would say that the other thing that's probably worth the committee being aware of is, as part of the council's EDI strategy, equality strategy, there's an action to develop a community cohesion approach for the council. So the community cohesion approach is about how we work with communities and get that going. I appreciate that's not the same as tackling hate crime, but there is a kind of direction that's important for the council in terms of that community understanding and having a council position on inclusiveness and so on.
Thank you. I understand. I accept that, but I would appreciate a meeting and a discussion around that on a more detailed level, if that's all right. Thank you.
Andy.
Wasn't me, I promise. Thank you for the report. It is a subject of interest to me, so I have been through it quite thoroughly. And it does link through to our website, where it clearly shows the need to incorporate the domestic abuse and serious violence with the community safety partnerships, other agendas. I come from a family with a wife, 2 daughters, a mother, a sister, and sundry other female members. It would be foolish of me to do anything that would be absolutely in favour of the work, the sterling work that's being done, the Pineapple projects and the recently launched STARS, I believe, van that we're sending around to rural communities. All awesome work, absolutely awesome work. I am interested in seeing the needs assessment that has been done as part of the work, to see how that data, or what that data reveals, to see what other priorities there are out there, because our community safety partnership priorities, if the refreshed document that I looked at still identifies in that first paragraph that the priorities are reducing crime and the fear of crime, addressing risk, threat and harm to victims and local communities, and facilitating strengthening of Dorset's communities and the delivery of local initiatives. So I'm interested to see or hear about some good works that are being done on those sides, in addition to the good works we're already hearing about, which are the Pineapple projects and so on.
Thank you. I can just come back. We obviously have those main priorities in the strategy, and you've seen some of and heard about some of the initiatives that are aiming at tackling those. But in addition to that, we have local partnership coordinating groups within each police section. And those groups come together every month. They identify what local issues are taking place and put together a partnership response to those issues. And there are other officers here that can go into more detail of that. It might be helpful to have that outside the meeting if that would be useful. In terms of the needs assessment work, we do a general needs assessment every year, but more recently we've done more detailed needs assessments around domestic abuse and serious violence. They're not published because of the information they contain, but happy to meet up with Councillor Todd and give you some more information and insight into those.
I'm also interested to see where budgets are allocated as well. I'm not sure whether any data is available on that information, but it would be interesting to have a look at how that's aligning with our priorities as well. Thank you.
Just briefly, Chair, the Community Safety Partnership doesn't have a budget. The theory, I suppose, mainly behind community safety partnerships is how, if you take an issue like domestic abuse, it's not within the gift of any one organisation to resolve by itself. So it's about how, through mainstream service provision, partners can actually change their mainstream service provision to tackle those things. So things like having multi-agency meetings to look at domestic abuse, for example, is one of those areas where if we change our practices, it's just how we change our practices rather than incurring a particular cost.
I am perhaps looking for metrics to measure success against. I think is what I'm looking for.
When we were doing the chairman's briefing for today, one of the things that Andy mentioned was about these local meetings. And I went, oh, I didn't know about those as a local member. And to me, you know, a good local member are a key person in a locality, because we have, you know, so, I wouldn't say fingers in pies, but we have so many contacts and have that nuanced local perspective, because we're out there living it every day, and can offer robust challenge as well as be informative. And one of the things I suggested is perhaps that we can see if local members could be involved in some of these local meetings, so that we can have that exchange of information. I'm getting nods from the rest of the committee, so can we take that forward as a formal suggestion? Because I think we could all gain from that, in the same way you say about officers working in partnership. We're a partner too.
Absolutely, Chair. And I've already contacted the police lead on that, and they will be getting information out to members about those local meetings. So that's in train, and will be very helpful, I think, to involve members in those discussions and that feedback.
Thank you. Carol.
Thank you very much. I'm interested in just drilling down on 2.6. It just worries me that domestic abuse and sexual offences are much more prolific in some areas than others, and I just wondered which areas, and I wondered what sort of work is being done at the youngest age in school, where you know that some of the youngsters are watching porn and things that they shouldn't watch, and they believe that treating women is just absolutely fine if a slap's involved, and so on and so forth. And I just wonder what we're actually doing in that respect, and can we pinpoint these areas to actually target the schools in those areas? Also, there's an uneven distribution of antisocial behaviour, and again, perhaps what are we doing in those particular areas? It's just understanding, where are those areas? Are those areas lacking in some way, perhaps with youth provision? I don't know, but I think it would be quite good to drill down into some of those areas a little bit more.
Thanks, Chair. Yes, it's not an even spread across the council area when it comes to particular types of crime. Some issues are in more urban areas where there's just a greater concentration of people, and you will see that. But in terms of this information that we provide goes out to locality groups and to other groups so that they can be informed to do that. And one of the things I think is really important about the community safety partnerships work, picking up on Councillor Todd's point, is we're not making assumptions as best as possible. We're looking at evidence. We're trying to be driven by evidence and understanding. And some of the work around domestic abuse that we've done, for example, has highlighted that there's a lower reporting rate in rural communities than we would expect compared to urban communities. And it's by having that insight and drilling into that, and our work is informed by those insights. So there's various partners involved in the work, Children's Services being one of the main ones. They pick up on doing education in schools and so on. One of the recent things, actually, that members of this committee may be aware of is Operation Encompass, where the police inform a school if a child's been involved in a household where there has been an incident of domestic abuse the evening before. That's Councillor Cathy Logg was very keen for that to be rolled out to early years settings. That's now in place, and that's taking place to try and provide that extra support network. There's a huge amount that happens, obviously, but the point is about making sure that it's not just a blanket approach, but it's targeted, and those initiatives are focused on where we understand there to be issues and problem solve those issues.
Thank you. But is there any work going on in schools with the teenagers going on as we speak?
Thank you. Diane Evans, Business Manager with the Community Safety Team. As part of the funding that we've received for partners to deliver the serious violence duty, We had money last year, we've had a repeat this year. We've had a number of initiatives that have particularly focused on young people and prevention and early intervention, recognising that attitudes, behaviours, the whole kind of development of socialisation is very key at this in these areas. So we had a number of initiatives last year which are listed in the report. So including things like the Bystander Project, which was a really positive initiative, targeted initially in schools, but also bringing in our voluntary sector partners so that we could take that out wider into communities. We ran last year a Mentors in Violence Prevention programme, which was very much about upskilling teachers to support young mentors in school. Again, another bystander approach, upskilling young people to challenge their own and also their other pupils' behaviour. With this year's funding, we've been able to extend that project for a further year, and that project has also extended to incorporate healthy relationships. So it's grown, and that has come about from feedback. And interestingly, our initial needs analysis identified 6 key schools across the council area. For this year, a further 5 have come forward and said, we'd like that programme, can we talk to you about that, please? With the 6th that I believe is also under discussion. So it's very much one of those approaches where when schools can see it happening and can identify how it can be used in their setting, they're coming forward. Now, going further forward, I'm not sure about funding. We don't know. We won't know for some time yet about future funding, but that's something that we are rolling out this year. And it's very much part of our early intervention prevention approach to develop some of that early activity.
Thank you. I think it would be really interesting from a ward point of view if we had some of the statistics for our own area. I know that, for instance, in our hub, we could put together programmes that could address issues if we knew what they were in our particular area rather than a generic approach.
I think the officers want to come back, but it does also rely a little bit, I think, on low numbers, doesn't it? If you have something that is too low a number, you start to identify individuals if you go down to ward level data, but I'm sure Andy and the team will respond more fully.
Thank you, Chair. And just on that point about there are statistics available on the Dorset Police website, which is broken down into very local areas. So yeah, so that's useful. But the other thing I would mention is the meetings that I was mentioning earlier on the section level, that will be an opportunity to provide a bit more insight about what's going on as well. So once I've got the information on that and I can circulate it, that might be a route in.
Bridget. Councillor Bridget Bolwell, Bridport Ward. Andy was mentioning about supporting communities. I've just arranged in Bridport Ward for the Dragonfly project to be presented. And we had, so that was the community groups of CAB, the food bank, the community kitchen, and another, which I can't remember. So we had 12 people to do the training, which you deliver for free, although they can also do the training online. And that was really, really valuable. And I don't know if people know about it, but it upskills these community groups that when somebody may be talking to you about issues around domestic violence, domestic abuse, stalking, harassment, it's a 3-hour training, and it was really, really excellent to enable those community groups to actually support people within our community. And I can send, I've got all the info, oh, you could send the information, but I've got the, and they will come and do it for free, as I said, at your when you want it. And I was just thinking about having it for your family hub people.
Yeah, I think we're going to do the dragonfly.
Yes, it's excellent. Sorry.
Thank you. If I can just come back on that, because it's one of those projects we're particularly proud of, actually. But I'd like, if I could let Ian just explain a bit more about that briefly, because it is a good example of one of those things where we're working very closely with communities. And rather than kind of relying on a service to deliver everything, it's about how we work with local people to help them, upskill them to be able to become part of working in their communities to help.
Yeah, thank you, Andy. Ian Grant, Programme Coordinator for the Community Safety Team. And as you say, Andy, I think it's one of those initiatives we are really proud of in Dorset. One of the things I was going to say is quite often our providers being very innovative with the work that they do. It's something that Dragonfly, for example, is something that they built up from their experience of working within the communities and working with people who've experienced domestic abuse. And it's been running now for probably nearly 10 years. It's gone in different forms during that time, but essentially it's about going out to different community groups, working with communities to upskill, train them in what the signs and things to look out for around domestic abuse, and knowing where they can then go and support people to access specialist support. And it started in Dorset. Like I said, I think it was 2016, and it's now rolling out across other parts of the country as well. But particularly proud of it. I know I think for last year, I think they supported over 2,000 people within the community in terms of training and upskilling. So it's certainly something that we can promote, following this meeting, so people know where they can go if they would like to explore that opportunity within their wards or communities, because it is an offer which is free. We have that as part of our contract with the provider. So happy to share those contact details outside of this scrutiny panel.
It would be really good to have that circulated, whether we can do it with the minutes or perhaps just separately, because I was going to ask you, I hadn't really heard of the Dragonfly project, so I was wondering, is that something that you identify a need from the data in a particular area, that you've got a hotspot developing perhaps, or you've had new information that tells you what's going on? Or is it something that we can come to you and say, we're picking up that there seems to be more prevalence for whatever reason in our area? So it'd be very useful to have those contact details.
Absolutely, and what I would say is any information that you can share is always going to be helpful in terms of our provider and which communities they do go out and access. I would say they're pretty good at knowing different communities that they need to target and go out and support. But like I said, any information that anybody has that can support that work, absolutely take that on board.
Andy.
Thank you, Chair. I mean, I think the other thing I'd say, one of the real triumphs of the Dragonfly project is sometimes it's harder to get into some of our more rural, isolated communities and have that presence. And that's been one of the aims of the Dragonfly project, is to be able to reach out into those communities. I mentioned earlier on that we know that people from rural communities are less likely to report, and actually having a presence by local community people that can pick that up has been really important. So that's one of the ways we've been able to get that reach.
Thank you. Richard, you want to come back?
I know that there is a lot of evidence around our rural farming communities, and there's huge issues around that. And so that any of the community groups who engage with rural communities, including social prescribers, etc., I'm assuming that they do this training as well. But I must say that the different community groups that we had just with this initial training, the person from the food bank felt that it was such good training that she's going to arrange a separate training for all the people at the food bank. And I think it's really important actually to go out to our community hubs, family hubs, to make sure that actually everybody's trained there as well, because they even if you're in a rural community, almost like Bridport is, on the outskirts, that actually it's the family hubs that people are going to. So thank you.
Thank you. I've just noticed the time. We are at 12:57 and we have 3 minutes left. We can either accept everything and go home, or I need your permission that we just carry on for a few more minutes beyond 1 o'clock just to deal with the remaining parts of the agenda. Are you happy to continue? Yeah. Thank you. Sorry about that. So I think we've given your report a good airing. Particularly, it's been good to understand better some of the detail of the work that you're doing in partnership, but also the need to get that local demographic data so that we can help you to work better as well. So thank you very much for the report. Item 11 is the committee and cabinet forward plans. You will see that for our next meeting, we've got the performance dashboard. I've been doing some work with the performance team, looking at how the new dashboard is going to look. There is more information that still needs to be provided because of the move of public health back into Dorset for our remit. So they're still working on some of those metrics, but looking at the things that we've requested to scrutinise in the past and the way we've been working, they've been looking to change the metrics so that it should better reflect our needs as a committee. So when they come in July, we'll have a bit of an update of where they've got with that work. So it should be proved quite interesting. The Birth to Settled Adulthood, we've got the Independent Chair's Annual Report and the Ofsted Action Plan. September, we've got Future Care, more information on the Public Health Disaggregation and the Safeguarding Partnership Annual Report. November, we have got space if there's anything that you particularly want us to look at, so get your thinking caps on. And then after that, we start to go into the budget round. So doesn't it come round quick? It only seems like yesterday. So you also have attached the Cabinet Forward Plan, the Shareholder Committee for Care Dorset, and the Centre of Excellence, which is Coombe House. So do take a look at those. If you do see anything that you want to dig into a bit further, do let George and myself know and we'll get it programmed in. So, unless anyone wants to speak to that? No? You'll be pleased to know there is no exempt business, so therefore at 1 o'clock exactly, I'll close the meeting. Thank you, everybody.